Even prior to the pandemic, we all had reasons to feel stressed, but new challenges over the past year to our daily lives are taking a toll on our mental well-being. The Kaiser Family Foundation reported that in July, 53% of adults had been negatively impacted by worry and stress over the coronavirus. That was up from 32% in March. The National Alliance of Mental Illness has also seen a 65% increase in calls and emails since the pandemic started.
We're really seeing an increase in calls for help and support and even just information. So, we're all experiencing stress to the point of toxic stress. That's that chronic stress that doesn't let up.
For a lot of us, this is the first time that we've been dealing with prolonged stress, and it's affecting everything from our eating and drinking habits to even our sleep. It's also caused anxiety and worry for adults and children, and feelings of loss when it comes to important life moments and losing loved ones.
We weren't able to maybe handle and work through grief in the same way. We've lost celebrations. We didn't get to celebrate so many different things this past year.
And for many who had existing mental health issues, the pandemic has been more taxing. Prior to the pandemic, nearly 1 in 5 U.S. adults reported having a mental illness in the past year.
Precisely the thing that protects us from a pandemic, which is isolating yourself, that is precisely the thing that is not helpful and healthy for a person that is struggling with a mental health condition. So it's that perfect storm that's happening right now.
People with chronic mental conditions have also lost their outlets to cope with stress. This is true even for those who don't live alone.
The buffers are gone, like we're in the house, we're all together. Normally we can kind of get away from each other and have that kind of healthy space.
And while the creation of COVID-19 vaccines is a light at the end of the tunnel, giving us hope that the pandemic will come to an end, many experts feel those feelings of isolation and being overwhelmed will be hard to overcome.
There's going to be this wave, we think, for increased mental health problems and sadly, very likely increased deaths by suicide. So we have a long way to go.